Okay, we are going to live, huh?
Okay.
Yes, Dr. Ida, over to you.
Okay, thank you, Dr. Anna. Assalamu alaikum and a very good evening to everyone. This is Dr. Ida Islam. I welcome you all in another informative session with the topic of disaster preparedness and the role of pharmacists, presented to you by Giving Back to Pharmacy in Pakistan. Before we start our today's session, I would like to give a brief introduction about Giving Back to Pharmacy in Pakistan. That Giving Back to Pharmacy in Pakistan is an organization of volunteer pharmacists from around the globe working to share knowledge and best practices to improve pharmacy practice in Pakistan. Now, I would like to announce today's speaker, Dr. Tahir Aziz and Dr. Zahid Saeed. Firstly, our session will be divided into two halves. Our first half will be presented by Dr. Zahid Saeed, Dr. Tahir Aziz. Now, to our audience, I would like to give a brief introduction about Dr. Tahir Aziz that Dr. Mohammed Tahir is a consultant, leading practicing pharmacist, educationist, and hospital administrator over the past 2 decades. He has worked in a wide variety of professional capacities in both private and public sectors. He led several projects in pharmacy, capital budgeting of hospital, including development of Oracle-based and clinical decision support system. His primary interest includes the hospital pharmacy, health informatics, hospital project feasibility, and clinical pharmacy advancements. He had done his pharmacy graduation and master's of philosophy in pharmacy from University of Punjab, Lahore. He earned his executive MBA in 2009 through Lahore University of Management Sciences. He completed his Doctor of Philosophy from Pharmacy Department, Quaid-e-Azam University, Islamabad. He also earned several professional certificates, including Leadership in Healthcare Program from Utrecht University, Netherlands, and Hospital Management Program from Singapore. Now, I welcome Dr. Tahir to please start his presentation.
Okay, thank you very much. Can you listen to me?
Yes, sir, you are audible.
Okay, thank you very much. Thank you all. I would like to thank firstly Giving Back to Pharmacy in Pakistan to give me an opportunity to share my experience regarding the pharmacy disaster and preparedness planning, including operations management role of pharmacists. So as Rida has said, we have, two presentation. The initial presentation I will give and discuss with all of you the first part of the preparedness and the planning for disaster. And this is followed by Dr. Zahid Said, and Dr. Zahid will cover the operations management and the role of the pharmacist. So just a disclosure, this presentation has been prepared by Dr. Muhammad Tahir Aziz, Chief Operating Officer, Ex-Associate Director of Pharmacy and Military Services, SKM, CHNRC Lahore, exclusively for educational and information purposes. This presentation hasn't been reviewed by any person, nor any pharmaceutical company, or registered with any public authority or stock exchange. So let's start and with some introduction. I hope you have a very good idea and what actually we are experienced and remain, vulnerable to many events that cause large number of casualties. I am showing few of the example here. So like in 2020, there were roughly 8,100 fatalities reported caused by natural disaster events worldwide. In the recent Hathia earthquake, 724 killed and 2,800 injured. And obviously you have a very good idea about the COVID-19 pandemic. So far, 6.4 million deaths has been occurred. Has been occurred just due to COVID-19 pandemic. So what is disaster? Just a definition. A sudden, unexpected event that causes widespread damage and disruption, as well as injury and or loss of life, may be naturally occurring or man-made. The most important thing in this definition, if you have to look at the sudden and unexpected, these two words, I'm highlighted here because whenever a disaster will occur, this must be unexpected and maybe a sudden, and we haven't any idea when this will be occurred. So before moving ahead, we must look at the consequences and impact of this disaster. So like, for example, for pre-disaster, what things we have to look at, like risk assessment, like prevention, readiness, preparedness, or like the role of the pharmacist. And during the disaster, like how we can respond to the disaster, how the control will do, how we will do a management, including the resource management, how the communication will move on, and obviously after the post-disaster, which include the recovery, debriefing, learning, replanning, and like this. Now, look at all these pre-disaster, disaster, and post-disaster. The commonality is what? The role of the pharmacist. So this is now another one emerging, field and area we will discuss, one by one. So look at the evolution of pharmacist role. You can see over above bar where you can see the different consequences, and below where you can see some of the evolution of pharmacist role over the different decades since 1960. So like specific disaster events that have occurred in different regions of the world have led to advances in pharmacist roles during emergencies. So like, for example, before 1960, drug logistics, procurement, supply, or like dispensing, the major role emerging in the field of pharmacy. Now, after the event of 9/11, I hope you have an idea of 2001 in US, where the severe acute respiratory syndromes epidemic in 2003, like pharmacists were acknowledged for their drug expertise, including contribution in bioterrorism emergencies or like pandemic as well. In 2005, Hurricane Katrina significantly impacted regions of the US and highlighted the valuable pharmacist role in improving clinical services and the disaster affected communities. In 2016, if you have to look at two specific events in different parts of the world, the main one is Canada and Australia, which actually ignited the recognition of pharmacists' essential role in being a first responder in disaster and emergencies, providing mainly the clinical pharmacy services and starting from the prescribing, assessment, triaging, and how the treatment is given, how the medication therapy is going on. But some scholars suggested that that pharmacy practice has had to drastically move to meet the needs of the pandemic. So now we are in the era of the COVID-19, And I believe that this pandemic is the beginning of a new era for pharmacy practice. So moving forward, I feel there's a catalytic change in the pharmacy practice, basically. So can we say a COVID-19 pandemic catalyst for change in the pharmacy practice? I think so, yes. So think about the pharmacists in China, where the first to begin describing the adaptations and the extensions to pharmacists' role and services that were required to meet the needs of the patient in the early phase of the COVID-19 pandemic. So like in Wuhan, China, everyone have an idea that COVID-19 epicenter field, I hope you remember, the cabin hospital were rapidly built, and pharmacists were required to set up the pharmacy services within that cabin rapidly built hospital. So this is one of the major, you can say, the role emerging in pandemic situations. Sorry for a little bit busy slide, but this is an important slide. So pharmacists basically, if you have to look at the different domains, like in the public health, in the how the information dissemination and how the medication management basically is given by the pharmacist. So starting from the medication management, if you have to look at the circle up to the information and the public health, the pharmacists were reassigned from other practice settings to assist in providing care, basically in the field of hospital. So various tasks were performed by the pharmacists, and the major one I feel, the most important, how to compile a formulary drug, how to procure the medicine in disaster, how can we educate the patients, and how other clinical clinicians on the pandemic evaluate the available evidence to inform clinical decision for managing COVID-19 infections, how we can monitor the mental health well-being, and how you can see, to put effort to streamline pharmacy services. They outsource drug information questions from patients and other clinicians to pharmacy and other practice setting. So these are all, the new fundamental context you can see arises during the COVID-19. So in a nutshell, more authority is coming up, and more liberty moving toward the pharmacist side. Like, for example, a recent example, like a standing order of the COVID-19 vaccination that's occurring in US as well, you can see. So pharmacy disaster preparedness is what basically. So you can see actually determine the involvement of the impact on pharmacists during disaster to justify the development of strategies before, between, and after disaster. So globally, if you have to look at, there are existing policies on disaster management, emergency preparedness, and in the healthcare setting. So WHO, for example, has formed an international health emergency workforce policy. And many local governments have created policies on disaster management and emergency preparedness in the healthcare setting. And basically, that's outlined the potential roles that pharmacists can engage in to increase the efficacy of medicines, including the distribution of the medicine and the services in response to natural or man-made disaster. So with the perspective of the disaster, I will cover mainly the emergency preparedness, and we'll discuss in detail. So moving forward, so there are just natural disasters. Some of the examples you can see: the floods, storms, cyclones, tornadoes, ice storms, and volcanic eruptions, earthquake. These are all natural disaster examples. We have another one is tied with the internal disaster. Internal disaster, which includes those disasters which occur within the building or institutions, like fire, gas leakage, hazardous material spill, radiation hazard, or maybe one of the examples, the terrorism extra as well. And a third one is epidemics, and obviously disease outbreaks that become widespread and affect a whole region, basically. So these are mainly the three types where we can, see with the perspective of disaster, basically. So look at some of the phases of the emergency, and once you have, disaster emergency, how you will move forward. So basically, the most important part is basically the prevention. So basically, it is how one can identify and analyze the long-term risk to human life and property from natural or non-natural hazards, and how can one eliminate these risks in practically, and if not, how we can reduce, the magnitude of their impact and the likelihood of their recurring. Secondly, then we have, the mitigation and risk, and then we have a preparedness. So in preparedness, basically, we identify the risk and then develop operational systems and how much we are capable before a domestic or, national emergency happens, basically. And then we have another one phase, the response, where we have to take some action immediately before, during, or directly after a emergency. And obviously our major aim to how to save the lives and the property and to help communities basically, and how we can recover all these ones. And lastly, the recovery, basically, that covers the coordinated efforts and processes used to bring about the immediate, medium, and long-term regeneration of a community, basically following a domestic or other emergencies, basically. So coming forward, mainly emergency preparedness, and I will just cover these 6 steps and we'll discuss in detail one by one. So, whether, it's a fire or the flood or an epidemic or maybe a power outage or some other situation, emergencies unfortunately hit the headlines often enough that the subject of a preparedness is no longer limited to security and basically the facility profession, basically. So if top management asks you what technology, or you can say the training or the manpower the hospital should invest in to help ensure that pharmacy is fully prepared for an emergency. So, that question shouldn't be considered an open invitation to start shopping, basically, very openly I'm saying, but rather than opportunity to discuss, use as much as backup data as much as possible, look at the needs for each type of pharmacy emergency, and mostly their impact on the pharmacy operation, basically. So let's see, the most important one part is know your risk, basically. This is the first part before disaster happens, basically. So you may have to use different tools. You can see here one of the major, very famous tools, impact and likelihood sample risk matrix here, where you can put the risk based upon the impact and the likelihood. So if you have, for example, supplies, what do you think in the stage of disaster, what happens to the supplies, medication supplies? So likelihood is this low, moderate, or high. And if you have a very, crucial supplies, the impact would be obviously very high. So this will fall maybe within the medium or critical, center of the risk matrix. So you may have to look at and list all potential emergencies and rank them in regard to importance and likelihood, which is essential to knowing what to do and what resource to invest, basically. So this metric basically helps to identify the areas where an investment is most needed, basically. So using a matrix basically to evaluate all the potential emergencies and your facility may face will give you a head start on many things, including being prepared to meet with management in support of any funding request for emergency preparedness. So I'm listing down a few of the example. Look at, is this your risk? Medication supplies, drugstore? Yes, I think so. Inventory levels, what happens at the time of earthquake or at the time of, for example, outrage of, fire in case of big fire disaster. What type of patient management problem you will face in case of large gas leakage, for example. What happens at drug pricing? Obviously, we are facing problem in the drug pricing nowadays due to COVID-19 pandemic. Look at electronic health record, and obviously look at some universal patient identifier. And this is one of the major, the problem the most of the pharmacies are now facing during the pandemic. So these are some of the risks I'm just listing down just for an idea how you, as a pharmacist leader, determine the risk of your pharmacy. Coming forward, the second step is how to build a team, and this is very important. Emergency plan should be the product, basically, inclusive team. This is not a single individual work, basically. You require a full-fledged good group within to deal with the emergency. So putting together a team of subject matter expert from different sections of the pharmacy department, and obviously this will help you determine the overall span of the plan, including a cycle of the 4 phases of the emergency management plan, which including the mitigation, preparedness, response, and recovery. I have already discussed in detail. So the team will help you where actually the risk is there, how we will move forward, and how we will, prepared for us, how the plan and effort to respond safely to the event. And once it's done, how the recovery action needed to return the facility to normal operation. So build a team, including pharmacy leaders, some are subject expert. You can add disaster management team as well. And, this will help you to make a very good preparedness plan or a framework to cope with the emergency. Moving forward, make a critical information quickly accessible. So when it comes to write up a plan, the thinking is something that the bigger the document, the better. I don't think so. This couldn't be a farther from the truth. To make a very good, a very big document. No, the plan needs to be very concise as to the threat or the risk, and then what to do. Long, drawn-out supporting document that may assist somewhere in the plan as an appendix or maybe as a supplement. And I feel this is fine. But when users want to know what the emergency is and what to do in that emergency, they want information to be very quickly readable and must be accessible, basically. So whenever you will do all these things, you must do some SWOT analysis. SWOT analysis, I hope you have an idea about strength. What is your strength? What is your weakness? What you have opportunity and what are the threats, basically. And again, you have to look at the drug supplies. And lastly, how the storage and the patient management again help you to consider how quickly the critical information may be disseminated during emergency procedures and emergency recovery period or in the operational plan. Let's move on. Update your alert and response procedure. So sometimes, notification tools like email, you have a voice or sometimes text blast are now very common in the developed pharmacy. And but keep in mind that no one will get the alert notification unless someone starts the process, basically. Not only by calling emergency number, but also by notifying the people who are responsible for sending out the message. Basically, this is more important. So effective communication by a pharmacist, I believe, is a very essential to improve the use of medications by patients. And this will ensure the optimal therapeutic outcome as well. So pharmacists can improve patient adherence as well to the drug therapy through appropriate strategies, including patient counseling, and you can say education as well. So think about, how you can update your alert and how the response procedures are working, basically. So communication flow must be in all directions, upward and downward. How you will communicate to the patient, actually, and obviously adherence in the to the drug in case of disaster, basically. This is the last thing I would like to emphasize, to test the plan. And obviously, once you've done all these things, you have to confirm yourself that will it work or not? And how do you know, basically? So the answer is basically a series of tests you have to do, or sometimes some recommend a tabletops, drills, and some recommending like exercises designed basically in a sense to go through all procedures that you are expected to know, basically. So in fact, that you need to know to save your own life and obviously the life of the other people, obviously the staff and the patient, basically. So whatever the framework you have developed, this framework you have to test, basically, the drill one. So going through everyone's responsibilities you have to do during the tabletop shows and who is responsible and what they do. This must be done in a simulation exercise, basically. So the most important element is identify weak links, basically, or you can say those items which require some actions basically after doing these drill. So sometimes the tabletop uncovers things that really need to be done and by whom. And sometimes, it's a far better review method than relying on someone who is someone not really in the loop to look over the plan and offer an opinion on what should be done, basically. So the purpose of the drills beyond, ordinary fire drills, I'm not talking about the fire drill, and full response, another exercise goes far beyond tabletops. I believe this is far better. And sometimes lectures, they can't bring a large cost here. So I will suggest you must do a simulation or drill exercise. So drill exercise, full response exercise are great to do, but sometime, lectures or tabletops are sometimes cost-effective way to continue to educate your, pharmacy staff on what to do, basically, if you can't do all these things. So you must know how the supplies and stockpile will be done in the drill, how the point of dispensing will work. For example, in stage of earthquake, say example, or like we have a very recent example of COVID-19, we face difficulties when we accept and triage the patient. Mainly, this is where the patient have very high risk in terms of contagious and transmit the COVID-19, disease. So how can you do this? So this is the way to have to judge and to rehearsal yourself. Then you have to look at the emergency use authorization. This is again one of the major area where you have to emphasize that in disaster, do you require some emergency use authorization or not? So once you do the drill, then you can understand, yes, this is required. Look at the electronic health record. This is again one of the major area where you have to think about. So like, for example, what contingency plan you have in your hospital or in your pharmacy in case of large failure or network failure. So how you can access the electronic health record during the disaster. So this is one of the major area where you have to emphasize and you have to do some contingency drill specifically with the hospital information system, basically. And lastly, we should look at the PPEs, like all these things. And how the command post coordinate with the agencies. So if you have a disaster plan, you must have some command post of the hospital as well. So how your pharmacy will coordinate and communicate with the command post, or another, some hospital called as a disaster management team. So how your drill and exercise help you to emphasize and look at what links, or you can say the weaknesses are there in coordinating and communication with the command post. So once you've done this exercise, you have to replan all these things. So how, replanning in a sense, you have now identified some weaknesses, you have identified some loop. So for example, like how the authorization, for example, I'm giving some of the example, how the additional pharmacists provide the services, for example, how you will do this if you identify this as a weakness, how you will address the workforce and workflow issues that prevent full and effective pharmacist engagement in emergency or say like COVID-19 response. You have another one, address shortages and continuity of care. How you can remove the barriers for pharmacists to provide continuity of care if a medical product shortage exists. So this is a very important aspect you have to think about. Then you have to look at the adequate resources and tools. So you must ensure adequate resources and tools for pharmacy. Professional, obviously, to provide patient care and protect their own health, obviously safety during emergency, like all these things. And lastly, look at the pharmacist participation. So this is very important to enable and facilitate pharmacists. And sometimes I said the trainees as well, to step in during emergencies and to incentivize emergency and preparedness and response plan framework and participation by employees or to the institution like this. So you have to replan all these things. That's, and from my side, thank you all. Thank you to listening to all of me. Allah Hafiz.
Thank you, Dr. Tahir, for such detailed presentation. I believe that this will help pharmacists to understand their key role in any kind of natural calamity or any other disaster situation. Now we are moving forward towards the other half of our session. For this, allow me to introduce our second speaker, Dr. Zahid, with our audience. Dr. Zahid Saeed is a patient care oriented young pharmacist, graduate of Akhtar Said Hospital College of Pharmaceutical Sciences in 2016, having a diversified experience of working in Sarvet Pharma, one of the biggest chain pharmacies in Punjab, and a former trainee and ambulatory care pharmacist in Aga Khan University Hospital, Karachi. Currently pursuing his MPhil in pharmacy practice from University of Sargodha, meanwhile working under primary and secondary healthcare department Punjab at THU Hospital, Safdarabad as a clinical pharmacist, pharmacovigilance officer and hospital drug inspector. Now I would like to welcome Dr. Zahid in our session. Assalamu alaikum, Dr. Zahid.
Walaikum assalam, and thank you so much for inviting me today. I will take it from here in the context of Dr. Tahir's presentation.
Okay, sir. You may start.
Thank you. So I have no disclosures to make, and this presentation is solely for the education purpose. These are the few learning objectives, and I will be specifically focusing on the public health pharmacy education and operations management. Skimming through these topics, these have already been defined by Dr. Tahir, the natural as well as the man-made disasters. What is the basic difference? In case of natural disasters, the steps can be taken to minimize the effects. And in case of man-made disasters, these can be avoided with careful planning and prevention methods. So if you Google this thing, who is the most accessible healthcare professional, the Google will give you results in like half a second pharmacist. We are the most accessible healthcare professionals. And that's what brings the responsibility on our shoulders for providing the help to the affected patients in times of disaster. Moving on to the background, there's this research which shows the participation of pharmacists in times of disasters. Mainly, the pharmacists look after pharmaceutical supply chain. Then comes the patient management, which is 20%, response integration, which is 15%, policy coordination, 13%, and other miscellaneous work, which is 8%. That's the overall image of the pharmacist in the globe. Moving on, the research article which was published in 2020 about the professional role of the pharmacist in healthcare system, which concluded that pharmacists themselves were very skeptical about the advanced clinical roles and intervening in the prescriptions and medication safety, consultation of prescribers. So there's a lot need to increase awareness among pharmacists' role, and then obviously comes the disaster management. We should also take care of that segment. International Pharmaceutical Federation, what does it suggest and what are its expectations from the pharmacist? So it expects from the pharmacist to develop guidelines in terms of disasters and selecting medicine and supplies, packaging, properly handling, storing the drugs and supplies, emergency supplies, making sure these are appropriately used, justified rule, right patient, right drug, right supply, educating patients as well as other healthcare professionals about the prevention and mitigation of disasters. And outside these pharmaceutical services, we are obviously the first responders and accessible healthcare professionals. We can also work a little extra mile and provide triage services, immunization, first aid to the affected patients. These are basically three phases of skills in which pharmacists can provide their services, starting from the search and rescue phase. Search and rescue phase includes the lacerated and wounded patients, which require the immediate care. Then comes the recovery and clearing phase, which would include the infections, spreading of the communicable diseases and infectious diarrheas. And last but not the least is the reconstruction and rehabilitation phase, which leads to the impact of psychosocial and psychiatric effects on the trauma of disasters and the patient. These are all the areas where pharmacists can provide their expertise and facilitate the patient in such times. Another thing is model standard for Canadian pharmacists. It has made a requirement for the pharmacist to maintain a valid certification in first and CPR. So every pharmacist who has been registered as a Canadian pharmacist is asked to maintain its certification in first and CPR, because these are the first most things whenever there is this emergency situation, maybe it is a man-made or natural disaster. National Disaster Management Authority has mapped out a plan for applying national plan in such cases. It starts from the Management Commission, and then they launch a plan in the provincial states, which then descends to the district plans. And in all of this roadmap, what I've seen is basically pharmacists are majorly incorporated in the supply chain management, cold chain management of the drug supplies and the emergency supplies in disasters. Moving on to the major topic, that is operations management. These are the points which I will cover one by one. Let's go through it. Supply chain, that's the basic and the most important role of the pharmacist. Obviously, the disaster affects a lot of people at once. So it needs uninterrupted supply chain and accurate forecasting that this much people have been affected and this much supply will be needed. Pharmacists can accurately estimate that. And then the pharmacies, these are available in every community, can serve as the venue for the screening of the diseases happening in any pandemic or endemic, and then making out the guidelines for screening of the patients. The next step is working condition and occupational safety. Providing public access to essential services. You might remember, if you related to COVID-19, everybody was looking for surgical masks, hand sanitizers, gloves. So pharmacies were the operational works where these supplies were being delivered to the patients. So pharmacists can estimate even the supplies and as well as provide these supplies to the right patient at the right time, and even the public. Protecting healthcare workers from infection and other harms. Obviously, when such happenings occur, the first line providers should also protect themselves from such infections and situations. That's why these supplies are also needed for the pharmacist as well. So they maintain the supply as well as the usage of these supplies to cater such needs. Expanded clinics and temporary hospitals. You might know in times of COVID-19, government of Pakistan, even an army, made some temporary hospitals. They utilized these areas like Expo Center and places like that for the provision of the care and then the just use of the medications, and pharmacists were also deployed and they assisted in such temporary hospitals. Routine and supplemental immunization. Right after we fought COVID-19, there was this emergence of multiple vaccines, and which suggested the usage of routine as well as these supplemental vaccines. So pharmacists were the ones who were deployed and should be deployed for the maintenance of the cold chain, the expiry management, the proper administration, as well as distribution of these vaccines. Expanded compounding capabilities. This is the picture which I've personally installed here. Is a sanitizer which we made in our hospital in a government sector in the bulk quantity for the disinfection. And these are the services which pharmacists can provide at the lower cost. And obviously, in such times, panic buying happens, and which leads to the shortage. So creating these things in bulk quantity can save a lot of expense and provide protection to many people. Point of dispensing. FD has informed about the point of dispensing, which is basically these are community locations at which state and local agencies dispense and administer medical countermeasures. And what are medical countermeasures? These can be vaccines, antivirals, antibiotics, which are intentionally to be used in accidental and naturally occurring public health emergencies. Emergency disaster shelters. Rescuing the patient and bringing them under a shelter is one of the most important things. Being the first line providers, pharmacists can also assist in providing care to the people and managing these shelters. The last but not the least topic I'll cover is public health pharmacy education, and it contains the following points. We'll go through these one by one again. Uh, if I also highlight the background of disasters, mainly categorized as three, uh, approved by International Pharmaceutical Federation Council in Brazil, August 2006, natural disasters affected over 800 million people's lives worldwide over the past 20 years. And man-made disasters led to the economic dislocation, collapse of political structures, genocide, mass population displacement. And if we just look at the epidemic and pandemic, uh, influenced the pandemic only in 1918 to 1919 killed more people than World War I. So there's huge gap and huge opportunity for the pharmacists to provide their services in such circumstances. For that reason, for providing education and awareness, American College of Pharmacy Education has added public health as a required element in the didactic PharmD's curriculum, which means you cannot complete your degree without going through this topic and includes all the public emergencies and disaster management. Another thing is for providing the resources. ASHP, that is the American Society of Health System Pharmacists, published a textbook focused on pharmacy preparedness for biological and chemical terrorism. So we basically deal with the drugs and biologics, and ASHP has also provided us with this resource so that we keep ourselves and provide right care to the right patient at the right time. Continuing professional education, that's very important. And that in times of COVID-19, you would have seen that multiple organizations, for example, WHO, Harvard, and ASHP launched virtual continuous professional education to keep healthcare professionals up to date. Obviously, unless until you are equipped with the most up-to-date knowledge, you cannot provide right care to the patient. And that's what it's needed to educate yourself as well as to the other people. And then comes the interprofessional education and collaboration. You cannot provide or seek the right information unless until you know your expertise and other expertise for the other healthcare professionals. For that reason, programs and events with public health professionals that include Master of Public Health degrees, epidemiologists, nurses, physicians, and social workers can also increase their awareness of the skills and competencies of pharmacy students and professionals so that they collaborate well. And then, as Dr. Tahir said, disaster management drills should be conducted to make yourself and then the patients aware then what to do in such circumstances. The most common are fire extinguishing drills, earthquake drills, and alert and alarming system in storm surges. The fire extinguishing drill contain the basic codes of race and pass. Race would start from rescuing people, activating the alarm, contain the fire, and evacuate the people. And then pass would be applied on the fire extinguisher, which would create the full aim, speed, and speed for extinguishing the fire. Moving on to the earthquake drill, that contains the basic steps: drop, cover, and hold, so that you save yourself from the major harms when some earthquake happens. And storm surge warnings give you an idea of the length of the water surge at the coastal cities. For example, we have Karachi, a coastal city. The authorities inform about the height of the sea level, as well as the maybe there can be some tsunamis going on, and they inform through that what action should be taken and what not. Moving on is the crash card and color code protocols. Crash cards are basically deployed in every health institution in the emergency departments, which basically contain two parts, the external and the internal. Internal would contain the oxygen defibrillator, portable suctions, manometer, and stethoscope, and then the internal would contain the medications, fluids, and respiratory equipment to save the collapsing patients. And these patients are the ones which need assistance in maintaining their airway circulation and breathing. And then the organic firms also encourage the usage of some specific codes, and they teach and aware their employees to know about them at mass. And these codes, the most common are the code red, which is fire, code black can be a bomb threat, code yellow, a misinformation. And what should be done in such circumstances is taught to the employees. These are the commonly used medication during disasters, and the therapeutic classes are given on the left side, which is analgesics, antibiotics, they can be burn care agents, they can be fluids, respiratory products, and vaccines. So this is all from my side. It's better to be prepared than to get ready. Thank you so much.
Thank you so much, Dr. Syed, to add on your side of information to this presentation. On behalf of Giving Back to Pharmacy in Pakistan, I really appreciate both of our speakers for their contribution. We truly believe that this will increase the understanding of pharmacists how to critically perform during any unfortunate or disastrous situation. Thank you so much, speakers.
You're welcome.
Yeah, thank you.
Thank you. So with this, we are finishing our today's lectures.
If
Thank you so
anyone
much.
have any question, you may ask in the comment box of YouTube. Meanwhile, we will share the feedback forms. Please fill the feedback form. Thank you very much.
So any question, I'm happy to, or Mr. Zahid, I'm happy to answer on this.
Sure, inshallah.
Yes, Ms. Ida.
Yes, sir. There was a question: to what extent does a pharmacist has a prescription role in the case of disaster? What is the role of a pharmacist? Like he can prescribe as well?
Okay. So, well, I don't know why all of this is, the early childhood wish as a pharmacist to prescribe actually the drug. I don't know why the people like all these asking.
Yeah, I agree.
All so, well, whenever we say the emergency and disaster, so think about this is a teamwork basically. So once you have to look at the magnitude, how it's work basically, what how the processes will move within the disaster process or within disaster, casualties or the emergency operation. So overall, emergency and disaster pharmacy serve basically to ensure the best possible pharmaceutical care for the population, obviously, and during obviously in the disaster. So with all expertise of pharmacists, I believe emergency and disaster, where the pharmacy plays a very highly fundamental role and in the medical care, no doubt. There's none of any question on this. But I believe there are certain countries where I have seen that they allow in some situation where the pharmacist can prescribe, but they can prescribe only emergency supplies only. So like, for example, I remember in UK, pharmacists have been empowered to assess and prescribe emergency supplies only, where you can see the patient's chronic disease medications, and they have given a full authorization to refill the prescription. Basically, the purpose and the aim is to reduce or decrease the burden basically on the healthcare system. So overall, the main aim and the task as a healthcare institution is how can we improve the patient safety in disaster. Whoever will do that, but must be you as a pharmacy, you must know that can we do this or not. So keeping in view within your vicinity. So like, for example, we have another one terminology we always use somewhere as override the prescription, like. So basically where you are initiate or adapt or renewing the prescription for the purpose of basically the continuity of the care basically. So, well, yes, sometimes it may allow, but only emergency supplies of patients and only in chronic disease medication. I hope I gave the answer.
Yes, sir, exactly. We do agree with that. I have a personal question from both of you, from Dr. Zahid and Dr. Tahir Aziz. Actually, what do you think that what Pakistani pharmacist has achieved and what they have learned during this pandemic, and where are the lacks, and what we can learn from this pandemic, and how we can improve it in the future? Because we have both from the private sector and the public sector as well. So, what do you think? Because from my point of view in UAE, we have learned, and they have recently launched that the pharmacist can start the vaccination, and even we can take the swab for the patient for the COVID-19 testing as well. So they are giving some extra responsibility that we were waiting for. Like at least the vaccination should be same like in America. It should be in UAE, and they have already started. What do you think? Where we are lagging, and how we can improve it in the future? Thank you.
Okay, so I think you have asked both of us. Zahid sir, would you like to comment, or should I?
Please you continue. I'll follow your answer.
Okay. So, well, in Pakistan, I agree with you. I have seen like in US, they have a standing order of COVID-19 vaccine as well. And they allow, pharmacy to infuse and to administer vaccine. That's correct. Like I agree with that. But in Pakistan, pharmacy basically is in a transition phase. Basically, the role of pharmacists emerging basically is here. If you have to talk about like 10 or 15 years back and look at right now, there's a vast difference between 15 years back and right now. So this is expanding basically, number one. Secondly, whenever you say the pharmacists can, do and prescribe, pharmacists can take part in the medication management. Pharmacists can help in uplift and optimize the medication therapy. Once we said all these things, we must, think about that either pharmacists are capable, either they are competent to do so or not. The concept here in Pakistan is basically emerging, and Pakistan basically is trying hard. And specifically, I would like to emphasize mainly few of the hospital, mainly the AHA, Shaukat Khanam, and Shifa, where you can see the full-fledged role of pharmacists, where they are basically accepting by the healthcare team, basically. So this actually outgrown, or you can say outliers, basically within the geographical condition of the Pakistan. Now coming toward, what we have learned from the pandemic. Yes, of course, no doubt, we have learned much more. After coping with the COVID-19 disaster, and the major one, like I have already highlighted few of the things. So number one is this, how we can overcome the shortages of the drug, basically. So this is the major, problem we faced during the COVID-19. Second thing, how can we improve our stockpiles, basically? How can we improve our inventory, basically? How the inventory may be managed within the system of the hospital pharmacy or in the community pharmacy like this. So this is one of the major area where we feel we are lacking behind. Moving forward, we have seen our new role with dealing with the COVID-19 patient. And specifically, when we are dealing with the antibiotic stewardship program, we are much more involved. How can you, deal with these specific patients? And here I would like to highlight that we, learn from the COVID-19 scenario. Sometimes we de-learn on this. And then third category, I would like to say the relearning on this. So the cycle of the learning, de-learning, and relearning is continuously going on. And still we are thinking about, how can we improve further within this scenario? I hope you can understand what I'm saying. COVID-19 is still, facing and giving a death to all over the world. And still, in the Pakistan is still emerging again and again. So we have done much more. With COVID-19, we have fight very well, but no doubt, still, I mean, so many areas we have to think about. In so many areas, we have to, again, I mean, do some preparedness, and so that in the coming disaster, we can do much better, basically. Thank you.
Thank you very much. Dr. Zahid, please add something from the public health.
Yeah, sure, sure. So basically, I am representing Punjab government, the primary and secondary healthcare department. Uh, we were like 242 pharmacists employed in 2020, and in the times of COVID-19, basically. So, right people at the right time by the government, and they utilize these people as much as they could. Uh, the government launched a few designations among the pharmacy community, which was pharmacovigilance officer, which is quite relevant to the COVID vaccination. Obviously, it was a new vaccine; people were afraid of it. The pharmacist played its role in making people aware about its benefits and then fighting the myths, as well as catering the adverse drug reactions and then reporting it to the authorities. Uh, yes, we were majorly taking care of the supply chain, the administration techniques, making nurses and vaccinators aware about the proper usage, the proper storage and handling things of the vaccine and biologics. And as well as we were also reporting and noticing adverse drug reactions. As Dr. Tahir suggested and said, that it depends upon the competency. So obviously, we are in the transition phase. Uh, Not every healthcare professional or pharmacist is well equipped and competent enough to provide the healthcare up to the mark. So there is this vast need for pharmacy training, workshops, and continuous medical education programs like this, so that we keep ourselves updated and provide the right information at the right time to both the patients as well as healthcare professionals. That's what is my take.
Thank you very much, Dr. Zahid Said as well. Okay, the last question from the leaders from Dr. Siddiqui as well. At the time of disaster, obviously, disaster can be of any sort. So, how you have like what are the other means you have to contact your staff?
So, for example, we have a process here which we called as a disaster drill. We have conducted regularly on, I mean, annual basis. So, like we have a call casket we have developed for disaster management team. So, for example, in case of disaster, you have a skeletal staff identify within the hospital that this staff must be available during the, say, example, in the drill. Now, in case you are doing a disaster, you have a disaster in the evening shift, say, example. So you have all contacts of the rest of the staff. So you may have to dial them, or you may have to coordinate or call them, and then you have to try to ask to come in the hospital and work with the other team's member. So one way, obviously, to coordinate through either phone, or even you have to call them. In case you don't, even if there is a problem, then you have another one way. We have another one, I mean, addresses there where we can do a drill here sometimes, for example, like most crucial staff, mainly the nurses or some other, let's say, example, pharmacists, then we may have sometime send our own transport as well, so that we can bring back to all such people to the facility. So this is the way how to, I mean, cope with the emergency in case you have a conflict of interest in terms of dissolution or devolution of your responsibility after the disaster event. Thank you.
Thank you very much, Dr. Zahid Saeed, and thank you very much, Dr. Tahir Aziz. Dr. Rida, you can please wrap up the session.
Okay, so we are winding up now our today's session. Thank you so much, participants, to be with us and sending your queries to us. We really hope that your questions are being answered properly. So thank you so much, Dr. Zahid and Dr. Tahir. Now we are ending our session for today. Thank you so much, everyone.
Thank you. I love
Thank you so much.
Allah Hafiz.